Hi, I'm Jason Bellamy, back at CSM 2014. We've talked yesterday about PT Now and some of the developments going on there. We talked about what they're doing with clinical practice guidelines and a new CPG Plus component that's being added. The clinical practice guideline in question is one we're going to talk about now with the three women with me today. So let's talk about the specific clinical practice guideline, and we'll get to the significance later, but describe it for me, what it is, and the process for development.
So the title of the guideline is Physical Therapy Management of Congenital Muscular Torticollis for Infants, and it focuses on 16 action statements that are graded recommendations based on a graded evaluation of the evidence for how to manage children with this condition. It starts with referral, goes all the way through the examination process, intervention and discharge recommendations, so it's a comprehensive guideline. And it was born out of the Section on Pediatrics initiative to start looking at knowledge translation products that would help the pediatric section members move research into practice. We had a committee that generated a list of ideas for knowledge translation, and this was one of them. And they felt that this is where they wanted to put some effort and finances. And so the three of us were on the committee, and we agreed to take the idea forward, and got a lot of support from the section on orthopedics, who had already been producing clinical practice guidelines, learned a little bit about their methods and their administrative support. And then we organized what we thought would be the appropriate process based on international guidelines. We wanted to parallel the international methodologies as much as we could with the financial constraints and volunteer efforts. And started 3 years ago, spent about a year on methodology, spent about a year on critical appraisal, and about a year on writing the actual document and sending it out. It goes through 2 levels of review before it's published.
So, Linda, take me through that methodology and describe maybe what was unique in this case a little bit.
Okay, probably 2 aspects were unique to the process that we conducted. The first one is we really rigorously appraised the literature that went into the guideline recommendations, and by that I mean that we actually scored and gave a score to every publication that we used. We got a team together from across the country so that we got a lot of individuals scoring, getting reliability and scoring, and made this, I think, as rigorous as we could make it. The other thing that we used that was unique, I think, to this guideline and hopefully future guidelines in pediatrics is the use of BridgeWiz. It was a software. Sandra got working with the person who developed the software. They really tuned it to our use, and it made the process systematic and really quite a bit easier.
So that's the unique part of the process, and that's significant in and of itself, the effort that was gone in and the methodology. What could be the significance then, Colleen, for this specific clinical practice guideline, the kind of the long-term effects, the so what, if you will?
In such a short period of time, it's made an impact already on clinical practice. Physical therapists that treat this diagnosis, children with congenital muscular torticollis, have been already adopting the guideline into their documentation, into their practice, and into their education to the families as well as to their staff. Insurance companies now are looking at the guideline and referencing the guideline for authorizations for treatment, saying how many visits are they going to approve over a period of time. And I've been approached already by a large payer in the Atlanta area that is using the guideline as basis for how much, for authorizing visits for children.
So again, this is the kind of conversations that are happening here at CSM. It's conversations about knowledge translations. It's a sign of what's going on. So to learn more about this, first of all, to learn more about clinical practice guidelines, you go to PT Now. And then to catch up with our other dispatches from conference, you go to ap.org/CSM/video. Ladies, thank you. I'm Jason Bellamy, and I'll catch you next time.